My name is Dr. Heather Moore. We are going to go over tonight how to eliminate shoulder blade pain. So a lot of times, I had a hard time actually naming this because I get a lot of descriptions of what I'm going to go over tonight. So basically what I'm talking about is pain in the upper back, pain that's underneath the shoulder blade. I get a lot of complaints of that. We see a lot, we treat a lot of that. And so I get that description of shoulder blade pain, upper back pain. If people Google it, it's thoracic pain. But something in the back area, the back of the shoulder, doesn't feel right. Right next to the shoulder blade I get. So there's all different types of names of what I'm going to go over tonight. But basically, it's this area in the back, kind of right next to your spine, right underneath that shoulder blade area, that gets sore on a lot of us, and people have a really hard time getting rid of it. It can be described as burning, stabbing, just some dull, achy pain when you move, pain with sitting at work, different things like that. So this is really, really common, especially if you have a sedentary job. So we're going to go over a couple things that you can do tonight to eliminate that. The first thing you want to do, and here we go again, posture, all right? So it's really, really important that you watch your posture at work, and really important that you're standing up about every 15 minutes, especially if you're experiencing this pain. Every 15 minutes, everyone's like, that's not logical, that's ridiculous. I don't mean you don't have to stand up and go and talk to your coworkers or take this massive break. You just have to stand up. You want to get yourself out of the posture that's causing you that burning pain, that causes you that pain in the back. Because chances are, if you're getting that, you're either sitting up way too straight with your shoulders jammed back, or you're hunched forward. Most likely you're hunched forward, your mouse is out here, everything you have is pulling you forward. What happens with that is your scapulas, your shoulder bones, these bones, the shoulder blades, whatever you want to call them, they're called your scapulas. What happens is they sit on your rib cage. Well, when you're forward like this, they go forward. All right, and the longer they're in that position, the longer those scapulas are in a forward position. That means all the muscles that are holding that scapula in place are getting stretched out, and they're really starting to get angry, and you're starting to get that burning, you're starting to get that pain. So that's why I say posture is such a big key in this, is as you slump forward, as you move your arms forward, as as that shoulder blades come and they go further away from that spine, you really start to develop muscle tears, you develop knots in your muscle. So that's why posture is so important. If you experience this at all at work, this is something that you must pay attention to. So every 15 minutes, you want to set a timer just to stand up and then sit back down. Doing a sit-stand desk is the best for this. A lot of people think that's not possible, or their companies are not allowing them to do that. So whatever you can configure, but you don't want to sit more than 15 minutes. And why is 15 minutes the answer? Because that's about the most your shoulders can take. Now, if you're sitting here and you're like, oh my gosh, at 10 minutes, like I have a stabbing pain, I can't even stand it anymore, then your timer just gets set for 8 minutes. You don't want it to get to the point where you have to literally almost go into tears. You want to make sure every 15 minutes you're up, you roll your shoulders up, back, drop them down, and then you sit back down. It gives a rush of blood into that muscle, or those muscles in the back, which they desperately need, and it allows you to reset your posture. So if you are in some hideous posture where you're forward and your mouse is somewhere out here, it allows you to reset that posture. So posture is such a big key. If you have any sort of shoulder, upper back, thoracic, you name it, type of pain in that back area, you've got to look at posture. Watch your phone, all right? This is how everyone likes to sit on their phone. It is dead wrong. And if you have that thoracic, that burning, that dull ache, whatever it may be, if you have pain in the back, on your upper back, near your shoulders, you need to watch how your phone is. You need to stop doing this, okay? The other alternative is to hold your phone up. Not really realistic, but honestly, that's going to be the best thing that you can do, because doing this, again, drives that shoulder blade forward, and it puts those muscles in a stretch position, and they get really angry. So you're going to form those knots. The next thing you can do is, if you have that pain, is you're actually going to do a stretch, which is going to actually kind of bring that shoulder blade away from your back. But what you want to do is you just want to clasp your hands in front, and you're just going to bring them forward, okay? And then you want to push your shoulders forward, and then you're going to drop your head. You're going to hold that about 30 seconds, 6 times. You should feel a stretch going across your back. It should not be painful, all right? You don't want it to hurt. It should not increase any sort of symptoms. If it does, you want to stop that right away, okay? But that's a stretch that you can do to start stretching out a little bit of those muscles, okay? The next thing that you can do is you want to start to strengthen, because as you sit like this all day, those muscles are actually getting weaker. So the more you sit like this, the longer you sit like this, the more likely it is that you have got weak muscles. And I don't care how much you go to the gym, if you're in a posture like this 8, 10, 12 hours a day, you're not going to beat it going to the gym for an hour. So one of the things you can do throughout the day is you just want to kind of put your palms up, elbows by your side, and rotate back. Just nice and easy. You're just rotating your arms back, squeezing your shoulder blades together. You don't have to weight this. This is not a weighted exercise. You want to do about 30 of these every hour. It's not meant to make you tired. Some people may get tired with doing that, and that's perfectly fine. Don't add a weight to make it more challenging. But what this is going to do is, again, it's going to allow that blood to flow into the area. You're developing inflammation as you're sitting there and you're slumping and you're stretching the muscles out in the back. So this will allow you, one, to sit up straight, two, to strengthen the muscles that you've just spent all morning, afternoon, evening stretching out, all right? And it will allow you to have better posture. So you want to do that about 30 times. Every hour is fine. It's not, when you take your, if you stand up and you want to do that every 15 minutes, totally fine too. You don't necessarily have to do 30 either. You may just do a quick set of 5. The idea is that your shoulders are down, your elbows are in next to your shoulders, and your elbows are at 90 degrees, okay? So it's none of this, all right? Everything's right here, and you're just squeezing back. The final thing that you can do in order to relieve this is you can get either a BC ball, you can get a golf ball, you can find a corner, okay? And you can just dig, find a knot, and then just kind of press on it, okay? So a lot of times there's going to be a knot in your back. Now, a corner isn't the best because it's going to get your whole spine, it's going to get your whole back. So it's not obviously the best. If you have a BC ball, if you have a golf ball, if you have a tennis ball, things like that, what you can do is you can then put it up against the wall, and you can just get on that area that hurts. Now, you might have to kind of move your shoulder forward a little bit in order to be able to get in there. You don't want to do that for too long, especially the first time, because it is going to be sore. You're going to break up some knots. So having a golf ball, a BC ball, some type of ball with you in order to go up and stand against the wall. When you get really good and it doesn't really hurt that much anymore, you can lay down on the ball and you can roll it out. And that's a little bit more aggressive, so you do want to be careful as you do that. But those are a couple things that you can do if you have any sort of upper back pain, if you have any sort of shoulder blade pain or underneath the shoulder. Those are going to help to alleviate it.